Imagine sitting in the living room when your elderly parent's face suddenly goes slack. They try to answer a question but cannot speak. For a terrifying 2 minutes, you are watching a medical crisis unfold, and then, entirely on its own, their speech returns. The immediate, overwhelming reaction to this kind of recovery is relief. Family members exhale, offer a glass of water, and assume whatever went wrong has righted itself. The crisis appears to be over. A disappearing neurological symptom does not mean you dodged a bullet. It means the target was already hit, and the next strike is imminent. This animation shows exactly what happens during a transient ischemic attack, or TIA. A tiny clot, often from an ulcerated plaque or the heart, travels up the carotid artery and wedges into a tight branch, temporarily starving a section of the brain of oxygen. Minutes later, the clot breaks apart or shifts. Blood flow resumes and the physical symptom vanishes. Even though the blood is flowing again, the diseased artery that produced that clot is still highly active. According to the American Stroke Association, the 48 hours immediately following this brief event carry an aggressive 10% spike in the risk of experiencing a massive, permanent stroke. The true medical emergency does not end when the symptom clears up. The emergency begins the exact second the person returns to normal. Public health campaigns have done an incredible job training us to recognize stroke symptoms using a single acronym: FAST. Face, arms, speech, time to call 911. Look at this breakdown of the FAST acronym. While it is highly effective for identifying specific focal deficits, it leaves out 3 major warning signs. It ignores more than half of the body's most critical transient neurological alarms. These missing non-focal signs, like sudden confusion or balance failure, occur constantly in the elderly population. But clinical data from UPMC shows they disproportionately affect female patients. Relying entirely on a 4-letter acronym leaves a deadly blind spot in public awareness. Millions of female seniors are left unprotected because their symptoms don't fit neatly into the letters F, A, or S. To understand what we're missing, we first have to cover the focal signs everyone knows. These are sudden facial drooping, unilateral arm weakness, and the inability to form or comprehend speech. If you suspect a problem, the immediate bedside tool is the arm drift test. Ask the person to close their eyes and hold both arms out, palms up, for 10 seconds. If one arm drifts downward involuntarily, you have a clinical finding that justifies dialing 911 immediately. This brain map shows the middle cerebral artery territory. Face drooping, arm drift, and slurred speech all share a distinct vascular geography. They appear together when this specific large section of the brain's left hemisphere is temporarily choked off from its oxygen supply. These 3 symptoms are famous because they are highly visible. But treating them as the only reasons to go to the emergency room ignores the anatomy of the rest of the brain. Beyond the FAST framework, the warning signs become terrifyingly abrupt. The first is a sudden, severe headache that reaches maximum agonizing intensity within 60 seconds. This is a thunderclap headache, and it requires immediate imaging to rule out a ruptured intracranial aneurysm. The second hidden physical sign is the unprovoked drop attack. A senior goes from standing normally to instantly collapsing on the ground without tripping over an obstacle and without losing consciousness. This collapse happens because a temporary vascular blockage in the brainstem instantly cuts off the nerve tracts responsible for bodily coordination. The legs simply give out. Here is a simulation of the third physical clue, amaurosis fugax. It is a sudden, painless loss of vision characterized by a dark curtain rapidly descending over one eye. The blindness lasts for seconds or minutes before the curtain lifts and sight returns to normal. Because these events pass so quickly, families invent benign explanations. A drop attack is written off as clumsy footing. Transient blindness is blamed on needing a new glasses prescription. Any sudden, unprovoked physical failure in an elderly adult is a blaring neurological alarm. It is not an inevitable byproduct of aging. The single most ignored TIA sign involves no physical collapse at all. It is a sudden, profound state of confusion where the person entirely loses the ability to form new memories for a brief period. The behavioral loop is highly specific. The person will ask a question, listen to the answer, and then ask the exact same question 2 minutes later. They appear bewildered and anxious, but they are awake and responsive. This presentation, transient global amnesia, goes unreported because the patient retains absolutely zero memory of the episode once it ends. They cannot advocate for their own medical evaluation because to them, the event never happened. Witnessing family members often observe this amnesia and attribute it to acute fatigue, severe dehydration, or a bad reaction to a new medication. They give the person a glass of water and tell them to lie down. A sudden return to normal mental function reassures the family that the person just needed rest. That reassurance is a trap that keeps them observing passively at home instead of calling emergency services. This comparative bar chart maps out how these symptoms present across demographics. Male patients heavily index on classic focal symptoms like arm weakness. Female patients are statistically far more likely to experience generalized non-focal signs like sudden confusion, extreme weakness, and memory failure. This physiological difference creates a triage bias in the emergency room. A man presenting with a drooping face triggers an immediate stroke protocol. An elderly woman brought in by her family after an episode of sudden confusion is far less likely to be evaluated for a vascular emergency as the first diagnostic step. There is a direct, actionable way to force the correct diagnostic pathway. If you bring an elderly female relative to the emergency room following a sudden episode of confusion or amnesia, you must explicitly tell the triage nurse that you suspect a TIA. Framing the chief complaint around a suspected vascular event ensures the patient receives the necessary brain imaging and cardiac monitoring rather than being discharged with a recommendation to rest. Have you or a loved one ever experienced a strange, fleeting symptom that you brushed off at the time? Share your experience down in the comments. It might help someone else recognize a warning sign they would have otherwise ignored. If you found this video helpful and informative, make sure to like the video, subscribe to the channel, and hit the bell icon so you don't miss the next one. Until then, take care. May we meet again in the next video.